Introduction. Otitis media with effusion, or OME, is a condition characterized by inflammation and fluid accumulation behind the eardrum in the middle ear. This fluid can be very thick and sticky, which is why otitis media with effusion is sometimes referred to as glue ear. The middle ear is normally filled with air and facilitates hearing by carrying sound waves from the eardrum to the inner ear structures. When the middle ear is filled with fluid, hearing can become muffled. OME commonly affects children under the age of 2 who may later develop speech problems due to the hearing difficulty if left untreated. Causes. OME occurs when mucus builds up in the middle ear due to a poorly functioning eustachian tube. The eustachian tube connects the middle ear with the nasal pharynx, the area behind the nasal cavity. This tube normally drains the middle ear and keeps it full of air, enabling sound waves to pass from the eardrum through the middle ear bones to the inner ear. The eustachian tube can become blocked, causing accumulation of mucus in the middle ear. This fluid buildup can interfere with the normal vibration of the eardrum, making sounds muffled and difficult to hear. The eustachian tube may be blocked due to an infection, allergy, enlarged adenoids, or irritation and swelling from exposure to smoke. Drinking from a bottle while lying flat can also cause fluid to enter into the middle ear, causing infection and effusion. Children breastfed for less than 4 months have an increased risk of developing OME. Certain medical conditions, such as Down syndrome and cleft palate, are usually associated with smaller eustachian tubes that can lead to OME. Signs and symptoms. Children with OME do not exhibit classic earache symptoms. They do not have pain or tenderness of the ear or fever. Often, the condition is diagnosed by the doctor at a routine well-child visit. A child with OME may have noticeable hearing and speech difficulties, may speak with a loud voice, watch TV with the volume turned up, and perform poorly at school. Diagnosis. Your doctor will review your child's symptoms and medical history. The ear is examined with an otoscope. A tympanometry test may be performed to assess middle ear function and movement of the eardrum, and can determine whether fluid is present in the middle ear. A hearing test is performed to find out how well your child perceives sounds of different volumes and pitches. Treatment. To minimize the risk of otitis media with effusion, your doctor recommends that you reduce exposure to smoke and remove allergens such as dust and pets from the environment. A child's head should be elevated while bottle feeding. Breastfeeding is encouraged. Hands should be washed regularly. An antibacterial solution should be used to clean toys. Most cases of OME will clear on their own in a few weeks or months. Your doctor will use a wait-and-see approach to assess if the OME has resolved. Your child is monitored for hearing and speech problems. In case of an infection, antibiotics may be prescribed. If enlarged adenoids are identified as the cause of OME, they may be surgically removed. Children who have chronic OME may be treated by ear tube surgery, also called myringotomy, with tympanostomy. Ear tubes are small, open-ended tubes inserted into an incision in the eardrum to ventilate the middle ear with air, equalize pressure, and drain middle ear fluid. Summary. Otitis media with effusion is a condition that is usually seen in young children and can adversely affect their hearing. It often occurs without symptoms of infection or pain and can usually be managed by conservative treatment measures. Chronic OME cases are best treated by placing an ear tube to facilitate drainage.